Hi, my name is Jason Nguyen, and I'm an intern at Richmond Health and Wellness Program. In this tutorial, I'm going to walk you through how to get a free COVID-19 test kit and how to perform the test from the comfort of your home. You can also contact Sandra for further assistance. She's the Resident Services Coordinator at Dominion Place. First, it is important to know what exposure means. When you are within 6 feet of someone who is showing symptoms of COVID-19 for at least 15 minutes, or an infected person who shows no symptoms but later tests positive for the coronavirus. This is considered exposure, regardless of whether one or both parties were wearing a mask. Some of the symptoms of COVID-19 include loss of taste or smell, cough, nausea, vomiting, and fever. When you show symptoms of COVID-19 or if you have had a known exposure to someone with suspected or confirmed COVID-19, you should get tested 5 days after the exposure. The specific kit that we're going to use is CareStart's COVID-19 antigen home test from Access Bio. There are 2 ways to get the test kits for free. The first way is to make an online order at USPS at special.usps.com/testkits. RHWP can definitely help you with the order. Another way is to contact Sandra directly, and she's available every Thursday. RHWP can also give you a test. Before the procedure, please wash your hands thoroughly for 30 seconds. A trick I usually do is singing happy birthday 3 times while washing my hands. Now, unpack the test components from the tray, which include 2 test cassettes, 2 vials, 2 caps, and 2 swabs. First, remove the test cassette and place it on a flat, clean surface. Next, gently peel off the vial seal and place the vial upright in the packaging tray. Remove the nasal swab from the pouch and carefully insert the swab up to 3/4 of an inch into the left nostril. Then slowly rotate the swab at least 5 times for a total of 15 seconds. After, gently remove the swab from the left nostril and insert it into the right nostril. Repeat the same process. After you're done on both sides, place the tip of the swab into the vial. Then rotate the swab vigorously at least 5 times. Remove the swab by rotating against the vial while squeezing the sides of the vial to release the liquid from the swab, and discard the swab in the trash. Next, use the cap provided in the packaging tray to close the vial. Hold the vial using your thumb and index fingers. Mix thoroughly by flicking the bottom of the vial. Once you're done flicking, bring the test cassette closer to the vial. You will see the sample well near the end of the cassette. Invert the vial and hold it vertically above the test device. Squeeze 3 drops of the sample into the sample well. After you're done, start the timer for 10 minutes and the result should be available afterwards. The test result should not be read after 15 minutes. There are 3 possible outcomes: positive, negative, and invalid. The result is positive when there's 1 purple line next to letter C and 1 blue line next to letter T. The result is negative when there's only 1 purple line next to letter C. However, your result is invalid when there's only 1 blue line next to letter T or when there's no line at all. Once you're done with the test, collect all the used test kit components and dispose of them in the trash can. And that is it. That is how you can test COVID-19 at home. If you want to be tested at a clinic instead, please contact your primary care provider or the following locations. The first one is Daily Planet at 517 West Gray Street, and the second one is Health Brigade at 1010 North Thompson Street. Please note the video was made following the most up-to-date CDC guidelines. The information is constantly changing, so if you have any concern, please contact your primary care provider. Thank you so much for taking your time to watch the entire tutorial. We at Richmond Health and Wellness Program wish you the best of health. Stay safe and have a wonderful day.